Köszönöm szépen, tisztelt.
Thank you very much. Well, I would like to speak briefly about diagnostics. It's a huge area, and I wanted to focus on methods that we use every day and maybe underline the methodologies that are most useful in the diseases and conditions that this foundation focuses on. Let's try to give a brief overview. This is a good idea to understand this because it will definitely help all of us understand the rest of today or the other presentations as well. So we have a motor system which very schematically includes two motor neurons which are connected to one another, and they operate our muscles. The primary neuron is in your brain, in a part of the brain that moves your body. And then there is a nerve that runs down the spine, the spinal cord. Then they connect to a secondary motor nerve cell, a neuron, which has several axes. And those axes form a fiber and a nerve that runs down to your final muscles, and those are the nerves and nerve cells that actually give the signals to your muscles to move. So this is the fiber or the nerve, and finally this is where it terminates. And if there's a problem, then the muscle will not be moving and will deteriorate. Now, if you're talking about problems with your motor neurons, then you're talking about a motor neuron disease. If it's other categories, we will be talking about all of these. The names of the conditions will be fairly clear. They will tell you what the problem is. So when you first go to the doctor, you usually speak about some symptoms you have. These are varied. There are many different symptoms. And from the nature of the symptoms, we can kind of deduct what structures, what elements of your system may have been damaged. So if people speak about loss of sensation in a part of their body, then we usually think it's not a muscle disease, but a nerve condition. If your muscle atrophies, wastes away, or there is a pain in your muscle, that could be related to any of the causes. But if there is also some sensory condition, then very probably there will be some nerve affectedness. Now, also the distribution of the symptoms across your body gives us a lot of information on what nerves might be affected. Most typically, this is the kind of muscle problems you have. The weakened muscles are located in the shoulders and in the thighs. But once again, there are many diseases that can potentially cause this type of muscle disease, muscle condition, muscle problems. So it is important to have very important to have appropriate diagnostics, which include checking the weight, the mass of the muscle, checking for calluses on your skin, checking for the strength of the muscles, any conditions, any symptoms that indicate that that body part has deteriorated from what it typically should look like and how it typically should function. Now, let's talk about some of these tests. Very simply, nerves could be either motor nerves or sensory nerves. Sensory nerves are responsible for collecting information from sensors that are located in your skin, in various tissues. And when there is an impact, you touch something warm is felt against the skin, then all this information runs up into the brain. Now, in motor nerves, this is quite the opposite. It's the headquarters, the center, your brain, that sends out electronic signals which run down along the nerves, and basically they tell your muscles to move. Now, there are many types of nerves in your body. It's easiest to imagine them as wires, basically, electrical wires. There is an insulating layer on the outside, and you have the copper, or which could be a massive single copper wire. It could be several wires twisted together, whichever way you want to imagine it. And now the insulation has a specific thickness, and the thicker the insulation is, the faster the communication is. The thinner the insulation is, the information will be running, taking its course very much slower. But when we speak about so slow transition of information or electrical signals, that's even that is very fast. It is as fast as a cheetah. And when the signal runs really fast, that's kind of like the Japanese super train. So we're talking about really large speeds, basically. Now, some nerves operate muscles, thick ones, and the thinner ones, the thinnest ones, communicate itches, communicate pain, and there are sizes in between for touch, for temperature sensing, and of course, the fastest communication runs along the thickest nerves, because some of those things are the most vital for a survivor. So we need to be able to react very quickly when the lion comes and we notice there's a threat. Now, there are two different ways, at least, of damaging your nerves. It's either the myelin, the insulation around it, that gets damaged, or it is the nerve itself. When the nerve itself is disrupted, then operation does not happen anymore. If it's a motor nerve, then your muscle will atrophy. If it's a sensor nerve, then you will have no sensation whatsoever. Now, the only way to improve this or to have some functionality is you may have some regeneration, and the nerve may be able to regenerate itself, but that does not always happen. When the myelin sheath of the nerve gets damaged, then the nerve continues to operate, but how it operates will change, and it will be much poorer in terms of quality of operation. Nonetheless, this has the possibility to regenerate itself in 2 to 3 months if the conditions are right, and if the causes causing the damage do not persist, then this can come back to a completely normal level. As far as we know today, there are no drugs, no preparations that can help this regeneration process. So even if you take vitamin B complexes, you're just increasing the content of vitamin B in your wastewater, because it's not helping your nerve regeneration. Now, the most typical way to test nerves is what we call ENG. You use electrodes that you place on various locations along the nerve, and then you measure how quickly the electrical signals run down the nerve. And then you have all the mathematics behind the calculations. And we look at the height of this curve, the peak, that gives you how strong the signal is, and you see how outstretched it is, and all these mathematical, analytical methods help you identify the operation of the nerve. Now, on the right, you can see a normal curve. This is what a measurement should look like. In the middle curve on the top central image, you see that the peak is much lower than on the normal. And also you can see that this distance right here, which is the time between the stimulus and the reaction, that is longer. That is a longer period of time than normally. And the whole curve is more stretched out over time than normally. So the table shows you all the calculations that the computer does in the background. This should be about 60 meters per second. And you see that the actual speed of the signal is only 20 to 30, which means half or 1/3 of the normal speed. And that shows that the myelin sheath, the myelin insulation layer outside the nerve has been damaged, and that is the most typical case in CMT, in one of the versions of CMT at least. Now, once again, this is a CMT1A ENG curve, and you can see that the actual measurement shows a lower signal than normally, and the signal runs down across over time in a longer period than normally. So you have the same situation for motor nerves as well as for sensory nerves. So what do we see here? What we see on this one is there is a very low signal. This is a sensor. On the top, you can see a sensory nerve. On the bottom, you can see a motor nerve. But some of the numbers are missing because where the signal appeared is completely normal. The response was as quick as in a normal situation, which means that the nerve was able to carry the signal to where it had to carry it. However, the reaction was very low, which means there are not enough nerve fibers within the nerve, which means that there is a damage affecting some of the nerve fibers. This is also typical to CMT number 2, type 2. In CMT, Charcot-Marie-Tooth type 2, it is some of the nerve fibers that are damaged and not the myelin sheath. Now, let's move from the nerve to the muscle. This ENG equipment allows us to test the muscle itself. We introduce a very thin metal probe into the muscle. It doesn't sound too good, but it's really very thin, and it's a very small thing. And you can get information about the operation of the muscle fibers in the muscle. Typically, normally, we're talking about half a square millimeter in a surface area in cross-section that you test at any one time. And if there's a problem, then you have fewer muscle fibers in that area, and you see a different response on the curve. Instead of a large single peak of a signal, it's kind of like when you put your wool sweater into 60 degrees of water and wash it into hot water and it shrinks. That's exactly what you see on the curves. And when you see somebody who actually has muscle atrophy, you have to decide what is affected. Is it the muscle that is affected, or is it the nerve that is affected and therefore causes the muscle to shrink, to collapse, to waste? So that's when you need the test. And when you see that the curves of the signals are too low, then you know it's a muscle issue. If the signals are tall and wide, and segmented and just not right, then you know that it's not really the muscle that is fundamentally affected, but the actual nerve that would be there to operate the muscle, but it cannot. And when I see this, I will be focusing on the neurons and the nerve rather than the muscle, because the muscle problems are just secondary. We also have additional ways to test the muscle because this ENG technique can only be used to check some of the muscle fibers in some of the muscles of the body. But we need other technologies to test large parts of the body at the same time. And what you see on the screen right now, especially the MRI, shows you a much better image of the total body mass in certain body parts. You can also take biopsies from the muscle, and then you can use all sorts of dyes. And that idea here is that different types of tissues take on different dyes and show different colors when exposed to those dyes, and that can tell you what the actual tissue looks like in real life, what is missing, what is it that you have too much of, and so on. Now, when you carry out all these tests, at one point you have to decide whether there is a genetic issue in the background. And if you have a suspicion, then it's a good idea to have actually a genetic test, which can, on the one hand, verify your assumption. On the other hand, you can also tell the family, okay, listen, there is a risk that this could happen. As far as we know, this is inherited or not inherited. Because, for example, if you have a Duchenne muscle atrophy, or somebody who is affected by Duchenne, they either can get treatment or they cannot get treatment based on what the genetic situation in the background is. Spinal muscular atrophy is the same. You have to know what the genetic studies show. We have to see how many copies of a specific gene they have, because that correlates with how severe the issue is. And that directly correlates with how you should be choosing the therapies, and you can estimate how effective they may be. So genetic testing gives you a whole swathe of information and perspectives, including making family planning decisions all the way down, and also treating people who are already affected. And I would like to say thank you for your attention at this point. And just before I leave the podium, I would like to give you some help. It is not easy to get reliable information from the internet, because even though it is widely accessible, internet only gives you information but not knowledge. Let me show you two screenshots of websites which actually provide high-quality information. One of them is Izom Info, which is muscle information in Hungarian. It gives you up-to-date information on cutting-edge research. Right now, you see the invitation for today's conference, and you see links to WonderFlora Foundation, which itself is a very well put together website that gives you very clear, easy to understand, easy to digest information about these conditions, these methods of treatment and diagnosis. Thank you very much for your attention.
Could we have microphone for the speaker, please?
Lesokkoltam a közönség.
I'm afraid I have shocked my audience, so there may be no questions. Okay, Microphone for the speaker. Okay, let me now pass the floor to Dr. Lena Szabó, who works at the Pediatrics Clinic of St Imre University, who's going to talk about Hungarian experience in SMA DMD.